Yeah, during a health crisis like the pandemic, it's ironic that one of the hardest things to do was actually see a doctor. Walk-in clinics were closed, treatments were canceled, even the hospital was overcrowded. But over time, Atrium Health figured out a way to expand and enhance their hospital-at-home program, bringing more high-level hospital-type health care from their front door to your front door.
Hi, Sabrina. Look at how good you look.
He's Atrium paramedic Chadwick Haggerty, visiting Atrium patient Sabrina Funderburg at home.
So how you feeling?
I'm feeling better.
I see you're still on the oxygen.
Yes.
What are we flowing right now?
We're at 2.
We're at 2. All right.
Checking Sabrina's at-home oxygen levels.
All right.
And her blood pressure, all right there on Sabrina's sofa.
You have any pain today?
No. Headache.
A little headache?
Yes.
Is it new?
No.
You feel good? You feel like you're back to where you were? All right, let's try it.
Sabrina's part of Atrium's Hospital at Home program, treating patients in their own living room instead of a hospital room.
You still feeling weak, or is that coming back?
Nope. So far, so good.
So far, so good. Okay. We'll walk to the hallway and then back down.
Here at home is where patients are more comfortable, where they can be with their families 24/7 instead of just visiting hours, and where Sabrina gets hospital care without leaving the house, personal care from her own personal paramedic.
At least you're not stopping after every step.
I know.
You're doing very good.
The ability to be at home with your loved ones in familiar surroundings, but knowing that you have the care you need when you need it, I think is the best of both worlds.
Atrium's chief physician, Dr. Scott Rissmiller, adds that the Hospital at Home program also frees up more in-hospital beds, especially during COVID, for patients who can't be treated at home. And it's a lifesaver for patients who don't have a nearby hospital or can't get to a nearby hospital.
To serve our underserved, whether it be urban or rural, giving them access, going to them in their homes, in their communities. No one at Atrium Health wants to go back to the old ways. We now have these new tools that we can deploy and continue to build off of.
We're bringing the hospital to them. You know, there's things that we do today in their home that they would have had to have been in the hospital to have done previously, which to me, I still can't wrap my head around. It's like, why didn't we think of this years and years ago?
For the Hospital at Home paramedics like Haggerty, the day starts at this Atrium Hospital Charlotte Supply Center, turning his paramedic SUV into sort of a high-tech hospital room on wheels.
You know, we all think about, you know, ultrasound machines as these big things that they roll around in the hospital. Well, this we just technically hook to an iPad, and we can see the same things that they do in the hospital. We can do ultrasound IVs, things like that right in the patient's home. So we can do 12-lead EKGs in their home, and we can actually transmit them to their file, or to the physician can view them. Generally, we can have up to 4 or 5 patients, and with those patients, we see them at least twice in most instances. All right, I got to get my main supply box. We can actually draw blood at the patient's house, and we can drop it right in the lab at the hospital.
Hospital at Home medics also have the same meds patients usually get in their hospital beds.
This is our medication bag. We carry a massive amount of types of medications.
Plus at-home equipment that patients can use in some cases to take their own meds.
Where they can put this in, they just press the thing, and then they put this to their nose and take a big breath, and their medication is administered. All right, so we're ready to go.
We are really looking to take virtual and do a quantum leap in regards to the care we provide. Sort of that proactive 24/7 access in the home, and deliver very high quality, high touch care in the home.
Well, hello there.
Hello.
How you doing?
I'm good. How are you?
Good.
Good morning.
You looking good.
Hospital at Home patients like Sabrina also get house calls from their doctor while the paramedic is there.
Do you feel very short of breath when you're up and moving around?
A little when I walk around.
face-to-face via mobile phone or tablet.
How have you been doing with your Xopenex treatments? Have you been doing those pretty regularly?
Yes. Yes.
Good, good.
With the paramedic taking notes for follow-up.
So you know the contact number. You probably know it by heart at this point. If you
Yes.
need anything, give us a call. Okay, I'm going to be in the area.
You have the medics that come and see you twice a day. You have the support of the same support you have in the hospital, but it's a little bit more personal to me. They make you feel so good. Even though, like, if you're not having a bad day, they even encourage you,
Well,
you know, that you're doing well.
I feel pretty good about where she's at right now.
You went through a lot, but you still have the support of the hospital there to help you. So you're never alone, and you feel confident, and you feel safe.
Atrium's Hospital at Home program also has a 24/7 nurse hotline that patients can call anytime for help or advice, sort of like that call button for the nurse that you have in your hospital room here at CMC. And those high-tech monitors we saw during the story that let patients check their own blood pressure and oxygen levels and heartbeat, well, they can also be monitored here at the hospital.